the definition nowadays depends on outcome. So that, for example, when a child protective services worker does their investigation of physical abuse, it's often founded or unfounded based on whether there are marks left on a child, independent of parental intent. So there have been situations where parents are not even disciplining in anger, but they may spank their child and unintentionally leave a mark, and they can still be in a precarious position in terms of founded abuse. It seems like perhaps what we're more interested in today is the effects of abuse, to include things that are scary. And certainly to be the victim of child abuse can be a scary experience, and it can have profound effects into adulthood. So often what we see in clinical practice, even with adults, is that many people struggle with what we call traumatic memories, where they have flashbacks or nightmares concerning events that happened in their childhood, where they may have been victims of abuse, or they may have witnessed the abuse of another family member. And for some people, not everyone, that tends to echo, and it often shapes their ability to have healthy relationships into adulthood. And we should be very clear about this, that the statistics are with regard to the effects of abuse when we're talking about a more traditional definition of post-traumatic stress disorder. The statistics are that maybe 30% of people that suffer trauma later develop symptoms of post-traumatic stress disorder. And so we need to be very careful about making any kind of blanket generalizations about the effects of abuse. Some people, for reasons that we don't fully understand, are much more resilient than others, and they can suffer abuse but are able to bounce back with relatively few symptoms. Other people are not so fortunate, and they may have symptoms that carry into adulthood.